I will be brief, but I would like to give you a little bit of a background. So as you know, the Alliance have been responding to the COVID-19 outbreak and crisis since its onset back in March. And with that, we released the first version of the technical note mid-March, which is available in 20 languages as of today. And we are very pleased to let you know that in the very few coming days, we will be releasing as well a version 2 where we have tried to improve the content of the technical note based on the learning that we had since March. The technical note, it's quite useful because you have 3 different parts really. The first one is really looking at child protection in the context of COVID-19, looking at the social ecological model as well as the child protection risks. And then there is the child protection response, and there is the working across sectors and with government, and you will have as well proper child protection specific programming. In addition to that, the past few weeks, the Alliance has been working on developing annexes to complement the technical note, and the webinar you're going to have today will look specifically at community engagement within the response. And so far, we have 6 annexes available as well. So you can find all the information related to the COVID response under our website. And in addition to having the link that you can see here, we have as well put right after the vacancy tab, a tab on COVID-19 where you can find all the information, as well as additional resources such as previous webinars. This webinar will be as well there, and the new postcards that we have released addressing as well key programming components in times of COVID-19. And I will stop here to hand over to my dear colleagues to guide you through the note on community engagement in times of COVID-19. And I wish you, I hope you will enjoy this webinar. Thank you.
Great. Thank you so much, Audrey, for kicking off the webinar. So my name is Michelle Van Akin. I am a child protection and GBV specialist with Plan International US, and I am also the co-lead of the Community Level Child Protection Task Force. The Community Level Child Protection Task Force of the Alliance seeks to strengthen the evidence base for community level child protection programming, ensuring child protection partners are supporting communities to protect their children. So with that in mind, we developed some guidance on how best to engage communities to support children during COVID-19. Today, we will be giving you a brief background to this guidance note. So the information that the resources that have informed it, we'll be introducing the guidance note. And then we are very fortunate to have colleagues from 3 different country contexts, from Bangladesh, from Mexico, and from Lebanon, who will be presenting how they have adapted their ways of engaging with communities during COVID-19. What I would like to finally emphasize is that the aim of this webinar is to send out a call for good practice and contextualize guidance and tools to all of our colleagues working with communities on child protection during this pandemic. We would like to hear from you about the challenges and successes you have experienced in order to share learning across countries and regions. We would like to emphasize that for this guidance note, it has been informed by Child Protection Minimum Standard number 17, which looks at how we engage with communities. It also draws from a recently released resource on community level approaches to child protection that looks at operationalizing Standard 17. There is a link on the PowerPoint, which will be shared after the webinar, where you can find the resources on a Google Drive. We drew from both of these pieces of work, as well as the work done by Mike Wessels on community-led approaches to child protection, to inform how we engage with communities during COVID-19. So these would be great resources to look at if you want some more information. I would now like to hand it over to my colleagues from the Community Level Child Protection Task Force, Caroline, Rinske, and Lucy, who have been a huge source of support and a driving force behind this guidance note, and who will be introducing themselves as well as the guidance.
Thank you, Michelle. Hello, everybody, wherever you are right now, in whatever time zone. We are thrilled to have you all on this webinar. My name is Caroline. I am Child Protection in Emergencies Advisor working for Save the Children. And together with Rinske and Lucy, we would love to present the guidance note to you, working with communities to keep children safe in times of COVID. And Rinske, Lucy and I have been heavily involved in all the work that has been done by the task force, which started with an evidence review and then led into the development of the reflective field guide. There's a training package, there's an online learning series, like Michelle explained. And this guidance that we're going to present really builds on that. Before I continue, Lucy and Rinske, could I invite you to also briefly introduce yourselves?
From Johannesburg, I'm Lucy, and today I am representing the Community Child Protection Exchange, which focuses on community-driven child protection, and we try our best to identify and share and support information and learning around that.
Hi, my name is Rinske Ellermeijer, and I'm working for World Holland, based in Amsterdam, and I will join Caroline and Lucy in their presentation.
So let's start with, I think, the most basic question. Why this guidance? Why did we decide to develop yet another guidance note? Well, I think we've all been seeing and hearing what is happening. And I think the report from World Vision, A Perfect Storm, on the impact of COVID-19 on children, which was released last week, confirms there is a major spike in the cases of children experiencing physical, emotional, and sexual violence, both now and also in the months and years to come. And whether they are forced to stay at home or in time are sent to work or pushed into early marriage, boys and girls face a bleak future. And unless governments, UN agencies, donors, NGOs, the private sector, but also communities do everything they can now to protect them, the impact will be long lasting. So basically, the importance of this guidance is about working together with communities, with groups in the community, with trusted members, to ensure that children are protected and are kept safe. So some of the key findings of this report, and we will be able to share this report with you after the webinar, up to 85 million more girls and boys worldwide may be exposed to physical, sexual, and or emotional violence over 3 months as a result of the COVID quarantine. 13 million extra child marriages are predicted by UNFPA to occur in the years immediately following the crisis, with at least 4 million more girls married in the next 2 years. And I think we've been reading in newspapers in many different contexts the increase in terms of beatings by parents or guardians, with helplines seeing an increase in calls. Now, learning from other infectious disease outbreaks, including Ebola, told us that effective responses, including the protection of children, need to place communities at the center of the response. Now, the guidance was the guidance we developed aims at supporting child protection actors working with communities to adapt their programming in light of COVID-19. And it includes key actions, but also hyperlinks to additional resources, links, and tips aimed at, to start with, understanding how communities organize themselves already to protect children. Secondly, working with communities to implement safe and effective ways to protect children. And that section focuses on awareness raising around COVID, but also around child protection risks and vulnerabilities. That section focuses also on strengthening the family and caregiving environment to promote children's healthy development and keep them safe. And thirdly, monitoring and referral of highly vulnerable children and families. And then we added a section, I think, which is included in all the guidance notes about the health, safety and well-being of community members. So to present the guidance, we decided that we want to share 4 key messages with you, hoping to basically pitch this guidance and trigger you to go and read it. So for the first message, over to you, Lucy.
Okay, so maybe we should also say that we decided to spare you all lots of writing on PowerPoint. So we got a presentation that's mainly got images, and then we're going to explain around this and the message. And in fact, I think when you get the PowerPoint eventually, you will see our notes, so you'll be able to read what we said. So this first message is really about working with communities to understand how they organise themselves to protect children in times of COVID. We know that communities always have been and still are really at the front line of protecting children or their children. And I think this is probably even more so in times of COVID, because service provision and other forms of support might be quite limited or very hard to access by children, families and other community members. So we also wanted to point out through the guidance that, you know, the communities and the groups which you can find in a community, which includes children, youth, maybe families living with disability, are also best placed to identify what might be a risk to children's protection during COVID-19 responses. So one of the key focus areas of this guidance, therefore, is to really encourage and support practitioners to work closely with communities and to build on what's existing in the community already. What are the structures? What are the capacities? Who are the influential and trusted people? Who can help protect children in the community during COVID-19? And perhaps to say, it's, you know, during this time of lockdown or social distancing, there probably is not an ideal time where you'd be wanting to go into a community and try and develop something new or complex. Like a new structure. You really need to be looking at what's going on already and how can you build on it. So our role as practitioners and what the guide is trying to help us do is not so much come in with all the answers, but to spend some time, good time, identifying, listening to a diverse group of community actors, and working really to facilitate a process where the communities can decide how they can mobilize themselves around COVID and infectious diseases. So it's really about providing some accurate information on COVID. We're not expecting communities to be public health specialists. They need the information, but we need to give them the space and the support to come up with workable community strategies. So you might want to think of some of the questions that you would ask around that. It's not a comprehensive list, and obviously please do go and read in the guidance, but some of the questions you might ask with communities who want to develop a COVID strategy might be: what groups are already in the community? What are they doing? How does the community deal with grief or loss or fear? How do communities provide psychosocial support? They might not call it that, but how do they do that to each other in their own community? Who are the most vulnerable community members? Do youth groups know where to find the vulnerable children and youth? Do women's groups know who are the families at risk? Are there church groups that know who are struggling for food or disability or maybe a mental health issue? So, you know, where other questions might be: where can children go or community members go to for assistance? What will happen to children who lose their caregivers or are separated? How will they be cared for in the community? And also, how can communities share information, accurate information about COVID-19 that kind of cancels out a lot of false rumours that tend to circulate? I think if you go to the guidance, you'll see that there's lots of, these are the key considerations. They're actually on page 3 of this guidance. And you'll also find links to questionnaires and loads of resources which will guide you in how can you find out more from a community. And then I wanted to just talk really a little bit about the images that you might have been pondering upon since I've started talking. And these are images, by the way, we should say, these were developed for the guide and toolkit for supporting community-led approach to child protection, which you can find if you go to communityledcp.org. And I think Michelle mentioned that this was developed by Mike Wessels. And it's really not really about COVID, but it's more about how you can support a community-led approach. But these images that we developed for it, the top left one is really just to remind us about who are the people who are included in if you go and talk in a community, if you consult, if you have conversations, who are included, who are excluded. So it's just really a little kind of talking point. The bottom left one is really just to remind us that communities are already protecting their children. They have a lot of ideas, they have strategies, they do have ways of doing, we need to build on that. And the third one, which is quite fun to consider, is this, ask the question, is this a community-led approach? My answer would be, it is based in the community, this particular approach, but if you look at how the sort of project in this little picture is rolled out, it's also a kind of a project where the NGO seems to have already decided they're going to establish what they're going to do, what kind of groups they're going to establish, how they're going to do it. And there doesn't seem to be a lot of time working with the community. And I guess it raises questions about how effective or sustainable their approach might be. And it's really encouragement for us to think a little bit differently when we're working with communities in COVID. Can we please spend more time working with communities, building on what they've already got instead of coming in with our ideas. So I think I'll stop there, and I think it's back to you, Caroline.
Second message, work with communities to strengthen the monitoring and referral of the most vulnerable children and their families. Which children are we talking about? We're talking about domestic violence, child marriage, sexual abuse and child labor. Think also of children or caregivers with disabilities and or chronic illness, those with elderly carers, child-headed households, refugee children, children living in alternative care arrangements, etc. And one of the things that is crucial in our work with communities is to ensure a prioritization of strengthening the mechanisms of identifying and referring these children. A key consideration is, for example, providing additional resources to adapt and strengthen child helplines. There's a lot of talk about hotlines, child helplines, and basically these mechanisms, it's fundamental that we support them to operate in the context of COVID-19. For example, by offering child-friendly COVID-19 counselor training and adapted referral strategies. Where possible, use already existing telephone hotlines and just ensure that they're up to date with the latest information and referral routes. And hotlines may get very busy. So consider how to increase staff and also support them to cover more calls, ensuring that they have the capacity and the confidence to address the phone calls that they're getting. Staff answering calls should be able to speak relevant languages and dialects so that they will be able to communicate clearly with those who are calling. Check out the guidance because we included related hot and helpline materials that are adapted for COVID-19. And basically that is one of the files that Lauren from the CPAOR has been keeping with updated resources on helpline and hotlines. Now, in relation to strengthening the mechanism of identification and referral, also consider raising the awareness of multi-sectoral frontline workers on their roles in identifying and referring child protection risks. So, for example, train them on risks and vulnerabilities that arise in times of COVID so that they understand. Train them on safe identification and referral, child safeguarding, but also child-friendly communication and how to ensure age and gender-sensitive approach. You could also think of working with children and youth through remote platforms because they're very often knowledgeable about vulnerable groups in the community, and they also may have strong relationships with them even online. Where possible, another consideration, reach out to organizations supporting persons with disabilities to gather information on families with children, and also children and caregivers with disabilities, including those in residential care and institutions, and find ways to collaborate with them. Once highly vulnerable children and their families have been identified, work with communities to monitor and support them remotely, with a focus on helping to minimize risks of disease, of course, but also reducing psychosocial impacts of quarantine, addressing child protection risks, and ensuring social protection. So strengthen the capacities of trusted community groups and members to support children and families facing special challenges, such as caregivers with mental illness, disability, drug dependency, but also domestic violence, which may have increased due to the pandemic. Very important, consider providing emergency cash assistance to families to basically mitigate disruptions due to COVID-related livelihood shocks. Do check in the guidance. We have a one-page guide that we hyperlinked, which includes guidance on virtual monitoring of children and their families during COVID-19, which might be useful for key community members as well. One last comment is, keep in mind that there's a difference between the work of trusted community groups and members who work with vulnerable children and families, and the direct support to individual children through community volunteers as part of case management. And it's important to know and understand the community level case management, and we're more and more involving community volunteers in that, should only be provided by trained and supervised community focal points that are able to provide support in a confidential manner and that have been reported to feel safe and equipped to respond. And in relation to community level child protection, we kindly refer you to the guidance notes on adapting case management in times of COVID, which has been developed by the Case Management Task Force. Okay, over to you, Rinske.
As Caroline has been presenting, the guidance note is designed to support actions that can monitor and ensure the safety and the protection of vulnerable children and families. And in this COVID-19 time, including with the measures that are put in place by the different governments, it can be very stressful and uncertain for people. And it is therefore very important to consider how to provide support to families and to caregivers during these times. And the third message we would therefore like to share with you and highlight today is concerning the work with communities on a holistic approach to promote the safety and the healthy development of children at home. There are a lot of considerations for families living through this COVID situation, and they include things like how can caregivers and children receive encouragement and support during lockdown situations, and what are ways to combat stress, anxiety and boredom amongst both caregivers and children. What are children meant to do if the schools are closed, and how will they continue their education? Is it safe for children to spend so much time online, and who are they communicating with when they are online, and what kind of information are they actually accessing? And how can communities stay connected even when there's a social distance and lockdown? The guidance note provides some tips and links to resources, hyperlinks to resources in relation to these above issues. And these include messages for children and their caregivers and families on how to keep safe, links to and advice on tools for better online safety for children. The guidance also includes a focus on remote psychosocial support for caregivers. It includes links to relaxation exercises that can be done at home with children. It has messages for caregivers and families on coping with stress during COVID-19, and including how the caregivers can help children to cope with stress during these times. It includes distance learning resources for children, fun games and other activities which can be done with children at home, and advice specifically focusing on families in which children with disabilities live. So the two images that you can see on the slides are examples from documents that are hyperlinked to the guidance note. On the left, you can see part of a document that includes tips for parents and caregivers on how to support their children's well-being and learning during school closures. And on the right, you can see part of an information fact sheet that was developed by the WHO on how to help children cope with stress. Both resources, plus many others, are hyperlinked to the guidance notes. We do realize that during this COVID-19 time, there's a lot of resources developed, and there are constantly changes being made. And we therefore would like to recommend to regularly check the Child Protection AOR resource menu, which is also hyperlinked in the guidance note, and these resources are updated very regularly. Lastly, I would like to mention that later during the webinar today, there will be a presentation from a colleague from Save the Children from Mexico. They will present the work they've done on engaging with community centers to make homes a safe space for children and adolescents to be during these lockdowns. And this will be a very practical example from the field that links to this third message that we wanted to share with you today. That's it for me. Lucy, I would like to give you the floor again and present the fourth message.
Thanks, Rinske. Okay, so while you were talking, I was trying to answer a few questions in the Q&A. I think everyone's starting to get the hang of it. And the big question seems to be, how can this guidance help us do things remotely or when we can't travel, and all the restrictions that go with social distancing and lockdowns? So this message is about that. I guess I want to maybe say we can't give you all the perfect answers, but we can give you some guidance and ways to start looking at things. So the message is really be creative and learn new skills. And I think that's what's coming out of this whole COVID crisis, is we can't do business as usual. We have to adapt everything that we normally would do. We have to be much more creative and teach ourselves new skills in many cases on how to work remotely. So we know that there's access to communities might be limited or even prohibited, that communal activities that normally take place have stopped, that it's not safe for us to encourage or ask communities to congregate or meet like we normally would maybe for certain things. So it's really become critical to look at remote methodologies, solutions and ways of engaging. And it's for practitioners to engage with communities and perhaps service providers too, but also so communities can engage with each other. So the guidance has quite a lot of links and examples of methods of remote engagement that can help you with your thinking. And I mean, you know, a lot of them are quite technology based. We've got things like, and I'm sure you're familiar with many of them, WhatsApp and other platforms where you can send messages, keep in touch, link people in groups, share pictures, videos, photos. You can also use phones and more simple messaging for counseling, providing services, maybe case management. We've got using a phone to maybe take pictures, videos, using social media platforms, TikTok. If you have been introduced to the joy of TikTok, you'll know it's having a moment right now, and making videos. There are things called Cellphilms, and we'll watch a little Cellphilm at the end of this so you can see what I'm talking about. There's so many ways you can share on social media. There are conferencing and other digital platforms. There's community radio that can broadcast information, entertainment, recreation like story time for children, and even educational support. And maybe even there are remote sort of education platforms. But I think that's the challenge, is a lot of these resources depend quite heavily on an access to technology like smartphones and social media. And, you know, you've also got to be able to buy data, you've got to have electricity. And so in resource poor or really remote environments, it's not always possible to use these methods. And the guidance has taken this into account, and we've really tried to suggest some less technology focused methods where we can. For example, the guidance says, well, what about using loudspeakers, printed and handwritten posters? You can have community bulletin boards. You can print flyers and images and put them at key locations in communities where they need to be updated with information and advice and support. You can do it in different languages. If you want a bit of inspiration, like of something that's actually being done, you can go into the guidance and find the link to the Child Protection AOR in Iraq, where they're unpacking the modalities of delivering awareness raising sessions when children and families aren't available or don't have access to internet. I think a big thing that's coming out at the moment is radio. It can reach large populations. It can really penetrate into remote areas. It requires often much less, relatively speaking, expensive technology. You can broadcast in local languages. You can choose what kind of content you want, and it can be accessed by people who are not literate. So radio is also quite an interesting approach to explore. I think something to stress about all of this is none of these resources that are in the guidance are going to be like the magic bullet, which is going to exactly address exactly your needs of your project remotely. And you do need to adapt them to the specific context in collaboration with the communities that you're working with. And I think also very important to point out is the guidance isn't advocating that everyone must now go off and create a radio drama show or make long participatory films. I think the methods are meant to inspire you in a more collaborative kind of creative response, which is what we're going to have to learn to do to keep children safe in communities during COVID. So the suggestion is that you go through the list of the guidance, the links, and some of those links will take you to hubs where there are even more links, and pick and choose aspects of a method or a resource which you think is feasible and manageable and effective in collaboration with the community. But I do think that working remotely for child protection is asking us to move up to a new level of being creative and learning new skills. So another point is, if your organization or you are not very experienced in implementing these kinds of sort of more creative remote methods, and you've got quite limited resources, because some of these things can cost quite a lot, some of them can be done cheaply, but it's really advisable to start small. Don't do a big ambitious project, and take your lead from what the community is already used to doing. So, for example, if a community really just has a simple communication system they might already use, which just relies on a few people who have some basic phones and they can send text messages, work with them to see how you can work together to support children and families during COVID using that system. If there is already a local or a community radio station set up, work with the community in that station, maybe facilitate bringing them together and working on how it could support child protection and well-being during COVID. So those are just a few kind of ideas from the guide, but obviously you need to go to the guide and read it. The images I've got here, I'll just quickly explain, and then I'm hoping that after that we will get to watch a couple of videos very quickly. The first thing you can see, that sort of colourful image, how to submit, that's an example of actually the Children's Radio Foundation, who launched a kind of multi-platform competition for children and young people to submit all kinds of artwork of any kind. It can be videos, dance, whatever, on all those different platforms, which talks about their experiences in a time of COVID. And I think it's probably a really good way of giving children a way of expressing themselves, something to focus on while they're locked down. If you go on the hashtag on any of those platforms, you'll see all the things that these kids have come up with. It's South Africa. There's a lot of really interesting stuff. The picture you can see below is actually, there's a video link that you'll get later on when you get this presentation, but it's actually a still from two young people, a brother and a sister, who've been making these in Kenya, these DIY face shields, which they donate to medical workers, and they made a little film about how they make them. So they share that on social media, and it's nice to see. It's not very long. You can link to that. I like these other two pictures because this is actually a Rwandan radio drama that's been written and performed by young people. I think WaterAid have supported it. They produce everything themselves. The top picture just shows the cast. The bottom really shows what it's like. They do have some technology, but as you can see, it's set up outside. It's on what looks like the school benches. I saw another picture. When it rains, they have to put plastic over it. So, you know, it's not a fancy studio, and they are making those, and lots of people are tuning in to listen to the advice and the information. This is a video about how to make a Cellphilm. It's 60 seconds long. So it's a Cellphilm about how to make a Cellphilm, which is a film on a camera. So go for it.
Cried that night against his chest. He told himself, start listening. Her mind's a mess at your expense. Soon you will be paying it. You're a fool to think you know where her heart wants her to go. Take for granted what she gives you every day. Listen to me. Listen to me. Every lie you write alive comes home fully. It's all out now, and you see how you might be waking up alone in a day now. Take a chance in life and love. You might find what you're holding here is bigger than your dreams combined.
That's great. So that's just a little taster of what a Cellphilm might be, that these are things that can be done by young people. And finally, I just want to show you one more thing, which I think is a really good example of how something that is sophisticated can become quite simple during lockdown. This is a clip of a radio recording made by an 18-year-old boy from South Africa called Lusuko. He's also a patient at the Red Cross Children's Hospital in Cape Town. They have a radio program that's made by and for children who are at the hospital. Normally, children like him would record in the studio, which is quite a fancy setup at the hospital. Well, I say fancy, it's fairly sophisticated. It's a studio for starters. But now a lot of these kids are at home under lockdown. And they've decided, because they've been trained as reporters, they want to make their own recordings. So this short clip really just shows how it can be a really simple medium. It can be a photo with just somebody recording what they're feeling, what's happening to them. This can help them link with other children, with youth, and also give a creative outlook whilst locked down. Obviously, if you want to use this method, you can use it for lots of other things as well. So I thought it might be good just to end by listening to him. He's kind of an amazing guy as well. So
my name is Lusuko Songap. I am 18 years old, a young reporter at Audrey Radio, and I'm also a patient at Red Cross Hospital, and I have a chronic illness named by spinal muscular atrophy. I'm located in Queenstown. Because of the coronavirus, I am practically social distancing, which means I cannot go to the Audrey Radio studio to record, so I'm recording this on my phone. My Audrey Radio listeners, apology for the background noise. I'm at home and I can't find a quiet place because I can't go outside. It's a lockdown. My family is talking about the coronavirus crisis here. It's getting loud, it's getting loud. The side is that I should be able to meditate myself at home, stay indoors, get quality time with my family. And the negative side is that everything that I plan to do is now on hold.
We're now going to have a presentation from our colleagues working in Cox's Bazar. So I would like to hand it over to you, Krissie, for your presentation.
Thanks, Michelle, and hello everyone. My name's Krissie. I'm going to just put my video on for a second so you can see who's talking, and then turn it off and just do audio. My connection's a bit bad. We're on the brink of a cyclone, and so apologies for that. But hello, and thank you for the opportunity. Just to give you a little bit of an overview of the context, In Bangladesh as a country, we have the Child Protection Cluster, which is chaired by the Ministry of Women and Children's Affairs. But here in Cox's Bazar, it's a little bit unique in that we have the Child Protection subsector. Given the high numbers of refugees, the Child Protection subsector falls under the protection sector and obviously links closely with all the work that's being done nationally. But in this presentation, I'm really only going to focus on the refugee camp setting, given the nuances that we've faced in terms of access, which I'll discuss later throughout the presentation. But I think it really emphasised the need to focus on community level approaches. But just to give you an overview of the bigger picture is that the whole country is facing all the challenges of COVID-19, but I'm really just going to hone in on the camp setting for the purposes of this presentation. Cox's Bazar hosts over 850,000 refugees, more than half of which are children. Child protection partners, including the government, local and international NGOs and UN and other agencies, have been working towards supporting child protection in these overcrowded contexts since the influx and even before, through a range of activities, including the usual child-friendly spaces, adolescent-friendly spaces, psychosocial support in group settings, case management, in a range of child protection responses and prevention mechanisms. And of course, one of these being community-level engagement. In the context of COVID-19, the whole humanitarian community faced a range of new challenges. The government of Bangladesh took a lot of steps to prevent and contain the spread of COVID-19. So in March already, all the learning centres were closed, as were all the friendly spaces for children, adolescents, and the joint education initiatives. And all group activities were suspended. And then by the beginning of April, we shifted into what they called critical mode, whereby the overall humanitarian footprint in the camp was reduced to only 20% of what it was before. And the priority, of course, was given to the health imperative. So with health and wash being given the majority of that 20%. For child protection actors, we were only permitted critical case management and at a significantly reduced number. So on any given day, only 137 caseworkers were allowed to access the camp, and only for critical case management, which was closely tracked. Prior to COVID-19, there were obviously lots of child protection issues in the camps already, but with the closure of facilities, the reduced oversight, the increased fear and anxiety, as well as the limited overall services, these child protection issues were exacerbated, and we saw new ones being emerged, and has already been discussed in relation to the whole, I think, the whole world in these containment measures. Since COVID-19, our ability to accurately collect data has been impacted, but our reports indicate that there has been a dramatic rise in certain child protection issues, including in particular a rise in violence against children in the home, as we saw that the recent report indicated. Violence in the home, kids and families are now in close confines and in their shelters, and of course increased stress, reduced stability, and a lot of other contributing factors. We've also seen an increase in child marriage, as we've seen this is taken as an opportunity with reduced oversight and opportunities for refugees to engage in child marriage, as was the practice previously. Children are more and more reported as lost or missing, and we've seen dangers and injuries have increased. So road accidents, drowning, and a lot of other injuries, because kids are wandering off, they're bored, they're stuck at home, they haven't got the usual stimulation. And the capacity of caregivers to adequately supervise children, now that there's nowhere for them to go, is also being limited. Of course, the context is ripe for trafficking and smuggling, as refugees are desperate for new opportunities. This overall context, given our reduced access and these increased child protection risks and issues, necessitated a rapid and dramatic shift in our approach, which focused on ensuring community-level mechanisms that were adequately strengthened and or established actually in order to respond to this context. So, community level child protection has always been a priority for the child protection subsector in Cox's Bazar since the onset of the emergency and since the influx in 2017-18. Child protection subsector has prioritised community level engagement. So for example, as soon as the influx came, there was establishment of a lot of these community-based child protection committees, CBCBCs, and prior to COVID, there were 865 of these. These were mixed compositions and a little bit hard to track, but they were doing definitely some community level approaches and they were being very much engaged, which gave us a good foundation. Engagement with religious and community leaders at camp level has also proven very effective. And we did have a lot of community refugee volunteers. As the child protection subsector actors have been working really closely with refugee volunteers who have been trained on various child protection activities, such as facilitation of the child-friendly spaces, psychosocial support. Many have received training on prevention of sexual exploitation and abuse and things like that. Largely, however, it's worth noting at this point that prior to COVID-19, this community engagement was established but heavily supported by child protection partners directly. It had already been identified, actually, at the beginning of 2020 that a priority for the subsector was to reevaluate and reflect on our community level child protection and basically to rejig the approach towards a more bottom-up strength-based programming. However, when COVID-19 hit, there was a need to dramatically, rapidly upscale emphasis on community level child protection, given the context as I explained, when only 137 for over 850,000 people, as we suddenly needed to almost exclusively rely on communities to protect children and deliver almost all of the child protection services in the camp. This shift in focus also needed to acknowledge the restrictions on large gatherings, so group-based psychosocial support couldn't happen anymore, and even our child protection committees couldn't operate in full capacity, but rather using small groups of 4 or 5 community protection committees or volunteers to implement all our child protection activities. So psychosocial support through home-to-home visits was supported, positive parenting messages were supported, all through these community level mechanisms. Monitoring and reporting of child protection issues also now needed to be undertaken primarily through engagement with volunteers and community members, and then conveyed to through our limited presence of caseworkers and our camp level focal points to the child protection subsector so that we can program in order to remotely support this community level. So it was a bit of a turn it on its head. Essentially, it was a shift from a community level child protection being supported by child protection actors to community level child protection being led by communities in order to support us to program properly. So it was really quite a dramatic turn on its head. So looking at monitoring and identifying, looking at deep diving into, I guess, 2.4 of the guidance, which is really a useful guidance, and I think we tried to do it in an ad hoc manner, of monitoring almost all of the information we receive as child protection subsector now comes from volunteers and community members themselves. Communities are being supported remotely to come up with their own plans to not only identify highly vulnerable children and families, but to a much greater extent to be in a position to respond to specific risks. While this is an imperfect system, as mentioned earlier, that the levels of confidentiality and case management and all of these things were not necessarily best practice, but we really needed to encourage communities to be able to protect when we're not there. So I guess this really led to how do we support remotely and through our limited presence for community-led planning. We asked community level focal points to be identified by communities themselves. Questions like who in the community is going to intervene if it's identified an imminent child marriage? Who in the community can a child turn to for psychosocial support? Who in the community is the focal point in the event of temporary separation due to COVID-19? We asked communities to really just think about these questions and come up with their own plans. We didn't need the plans ourselves as subsector. At this point, it was really about supporting communities to be asking the questions internally and coming up with their own system. Volunteers are also now much more heavily relied on for the case management than before COVID-19. They'd been trained, a lot of them, but prior to COVID-19, they were supported really just to follow up on the low risk cases, and currently the high risk cases and complex cases are still being supported by our caseworkers, our 137 that are allowed to access the camps. But really, we're now asking our volunteers to undertake the full realm, almost all of the steps of case management, from identification and assessment to some extent, and follow up and review with remote support by child protection actors to ensure a continuity of care and to ensure safe practice. Some of the tools we've developed so far to try and adapt to this sudden shift in approach include an interim guidance for the subsector, so we're all on the same page, with the second priority being given to strengthening community level child protection. We also have been working on and have finalised a specific alternative COVID-19 guide, where the focus again is on supporting communities to pre-identify internally who their preferred temporary caregiver would be in the event that the primary caregiver is temporarily separated from the children due to COVID-19, so taken to an isolation unit or to hospitalisation. So it's really, again, about asking communities, who would you prefer in your community to look after your child or to keep an eye on your child, and to make sure that that is at least agreed and internally using key community members to sort of keep track of that at a really micro level. Partners have also developed support on how to remotely provide guidance to volunteers, which was one of our partners developed that, and we shared widely. Everything's been really sort of come together, and that guidance is also will be linked here. And there's a lot of other there was an interagency guidance on remote case management, which belongs more in the sort of case management guidance, but given our unique context and lack of access, I think it was also relevant here in terms of the community level engagement. So there's more under development, and we're trying to really keep everything to just a few pages and simple as possible so that everyone who is scrambling to adapt. We also have a cyclone coming, so all of our emergency preparedness had to shift so that the focus was again on communities. Just quickly, I won't go into the challenges in great detail. I think they're probably very similar for a lot of contexts. But some of the key ones which I think, again, highlighting what was said earlier about just picking and choosing from the guidance about what's appropriate and applicable. For us, telecommunications is there to an extent, but there are challenges in that for a lot of reasons. Similarly with social media. Community members, key community members who had been engaged in community level child protection previously have a lot of other commitments. So they're often members of different committees and communities who are all addressing the health imperative and not necessarily having the time. So it's about really saying who in the community also has the time and the ability to support their own communities in this response. Rumours and stigma have also caused a lot of challenges for volunteers, which I won't go into in more detail, but I'm sure a lot of other contexts have experienced that as well. But more importantly, I think that COVID-19 has actually presented a lot of opportunities for the child protection subsector in Cox's Bazar specifically. Volunteers and community-led child protection members have expressed to our partners that they feel much more empowered and have been much more proactive, given that there's increase in responsibilities, and increased ownership by community members has been expressed, which was really encouraging. I also, personally, as subsector coordinator, see there'll be a lot more buy-in, I think, for our initial 2020 plan, which was to rejig and refocus our community level approach so that we can really recognise the importance of this being more bottom-up and less top-down going forward. So having gone through, I think for us as child protection subsector here, there's a lot that we can take out of this guidance, a lot of takeaways from this guidance. And I think some of the key ones that stood out for me is simple things like encouraging the soft skills and working to communities. I think that that's something we can still do remotely and through our limited presence, and we haven't probably paid enough attention to. Another thing that was mentioned earlier was engagement of adolescents and youth. And we know we've already identified that that is a gap. And I think some of the resources in this guidance note will be really useful for us to strengthen that quite quickly as well. I think we still also have a gap when it comes to caring for child survivors. So that there's some great resources in that guidance note, which I think we will definitely draw in to try and bridge the GBV and child protection community level approaches. I think that has been quite siloed in the past. And I guess one of the things, as we had our first positive COVID case last week only, so the containment measures of the government of Bangladesh have been very effective in that the first positive COVID case in the camps only was last Thursday. So I think we haven't paid enough attention to protecting the health, safety and well-being of these key community members that we're relying so heavily on. And I think the guidance note on working with communities is really going to be useful as we rapidly make sure that we are simultaneously ensuring the safety and well-being of these key community members. So I think my time is well and truly up, but I really look forward to continuing to engage and to learn from the rest of you and other contexts as we all adapt our programming to, and hopefully at least get some more buy-in generally about the importance of communities being at the centre of all of our responses in protecting children. So yeah, that's it from me. Thank you for the opportunity again.
My name is Zoubeida Abouasaly. I'm from World Vision Lebanon, and I work as Child Protection and Advocacy Technical Lead at the National Office. So I provide support on child protection programs and activities. I'll be talking today about working with faith communities to keep children safe in times of COVID-19. So as the COVID-19 virus spreads around the world, it is important that we all take responsibility for reducing the negative impact on our families and communities. In the light of the current crisis and due to COVID-19, faith leaders with the support of World Lebanon play a role in preparing, promoting safe and healthy behavior to reduce the spread, in tackling stigma and fear in community, and in providing practical care for the most vulnerable, with child resilience, family resilience, child protection. So World Vision Lebanon is continuing its partnership with churches and mosques to conduct spiritual nurture programs to children and families by agreeing to include previously tested modules with them on child protection. Faith leaders, with the support of World Vision Lebanon, have formed online support groups with their congregations that will help to reach out to the most vulnerable families. They are like supporting their initiatives to promote safe and healthy behavior, enabling them to take leadership in tackling stigma and fear in the community, enriching their care for the most vulnerable children towards protection risks, and fostering collaboration of faith leaders with other parts of child protection systems, like services and etc. As a result, parents involved reported to have been able to properly deal with their children during this stressful time. And parents report realizing stigmas of trauma, depression, anxiety, and others in their children, and being able to know how to deal with it, but also where to ask for help. So parents know where to refer their children for support, since World Vision is providing like referral systems. So parents receive trusted information also about COVID to disseminate for their children and beloved ones for protection and care. Children receive creative and safe materials to enjoy at home while they are in the quarantine, and families strengthen relying on each other more as a result of the program. Faith leaders are leading the initiatives, and they reached our INGO for the support. The project is existing relationship and programs with imams and church leaders from all denominations, Muslims, Sunni, Shiites, Christians from from Orthodox churches and evangelical churches. So, and we're building on what faith groups have created already, since the faith groups have already engaged in partnerships with World Vision, and they have already formed groups for child protection, case management, parenting, and all that stuff. The results are already reported from parents and children. Faith leaders are able to link their congregation with reporting mechanisms, with services, so playing the role of a catalyzer. So here we can see that we have the results in numbers. We have reached 28,750 children. We were able to reach 11,500 parents and caregivers. We were able to reach 5,900 families. We have 9 local child protection systems spread all over Lebanon. We have so far 60 mobilized faith leaders from all denominations. I would love to end with, like, faith leaders, they are channels to hope to the community for children, for child protection. And they can be catalyzers in engaging other parts of child protection system to change a crisis into a positive impact for children. Knowing that we have completely isolated parts in Lebanon that no one is able to reach to. So faith leaders are they play a key role in reaching out to those most vulnerable families and children, and to tackle child well-being issues in our country. Thank you so much.
Thank you. Good day to everybody. I am Selvia Vargas. I'm thematic counter officer in Save the Children Mexico, and I am delighted to present some of the work that here in Mexico we have built as part of the response to the current emergency. I am going to present to you a guide we made for families to ensure that homes are safe spaces for children and adolescents, and how, in collaboration with key members of some communities, we have been able to bring it to the families. Well, first, I would like to begin by briefly commenting on the context in which Mexico finds itself with regard to situations of violence. In our country, we have been experiencing an increase in violence for several years. This is not new for us, unfortunately. But the current pandemic situation has exacerbated the manifestations of this violence. For example, organized crime groups have taken advantage of the situations of social distancing to fight for ground. So obviously this has been increasing homicides and violence. Simply in the last days of March, 88 people were murdered every day. However, private space is also not providing security for families, especially for women. Actually, before the pandemic began, Mexico was in a notorious crisis of gender-based violence, and despite what some politicians of our country want to deny, the emergency has not reduced the rates of violence against women. On the contrary, there is a reported 25% increase in 911 calls for BBG cases. And this is considering that not all the women who have been assaulted are going to the authorities to report. This is because so many reasons, but that is why we expect that the real cases are much more. In terms of domestic violence, although there is no disaggregated data on how many children have been victims of violence, it is estimated that in Mexico, 6 out of 10 children under 14 have experienced at least one form of violent discipline. And the current social distancing does not improve this situation. This is because the spaces that may be safe for children, like schools or some other places that are not home, well, they are closed. So as you can see, this is a context that we cannot ignore in our response to the emergency. Taking all of this into account, we decided to create a guide that could help families to make their home a safe space. The approach we use to create it starts from conceiving the safe space from a holistic perspective. I mean, from the idea that safety implies not only protection, but also participation, equality, containment, and emotional care and education. In this way, the guide has been built from a child participation approach, and also ensuring that everything we propose includes a gender-sensitive perspective. Also, because this guide is made for parents, we thought that it was very important that all of the recommendations were proposed as tender care practices. This is because also we are responding to a very specific situation, that is the pandemic. We think that these practices can be integrated into the family's upbringing habits, and in that way we can ensure a safe home even after the pandemic. So these are the chapters that shape the guide. And one of the first challenges we faced was to design something that could respond to the diversity of circumstances that Mexican families are experiencing. To address this, we sought to provide suggestions in a general way that could be adapted to the needs of each family. We also sought to integrate an approach that conceives children as subjects of rights. And we also prioritize the promotion of socio-emotional aspects in each chapter. This is because we thought that adults should be able to provide a safe space by being present with their children in a more conscious way, as well as being responsible for their own emotional processes. Of course, another challenge we faced once the guide was completed was how we could get to this guide to the families who need it. So in that sense, it is worth mentioning that we have had partnerships with private initiative, government, and other organizations in the health, education, and protection sectors. We believe that this is a great advance in terms of reaching populations that we would not otherwise be able to reach. So now I'm getting to the point we were all interested in, how we bring this approach to the communities we work with. So Save the Children Mexico has worked with around 150 early childhood care and development community centers, the ECCD centers, for several decades. These centers are community spaces where children have access to early education and preschool, but they also represent a safe space for protection and care. This is because they are located in the most vulnerable areas of Mexico City and the metropolitan area, and also because they emerge as a response to the lack of social security for families in those areas. So since then, they offer care and protection services and have become references for their own communities. Our work with these community centers is through their coordinators, who are mostly women from the communities themselves. And during these emergencies, these spaces are reference point for the protection of families, and the coordinators are key members of the community, as they know the conditions and the needs of the families. So once we share the guide to the ECCD centers, and we also have shared videos with some of the activities we included in the guide, its implementation has been through the communication that the coordinators have with the families, which is mostly through WhatsApp. So this has allowed the families themselves to select the information that fits their needs, while the coordinators support them with specific doubts or provide some other information they think they might need. So according to the coordinators, with the support of the guide material, they have been able to support the families in terms of increasing their confidence as parents and enabling the children to have independence and security in their homes. They have also told us that it has been very helpful in managing stress, as well as in organizing activities at home and opening up age-appropriate spaces. Also, a very important part of this guide is that it has also been a way to families to know what to do in cases of violence in home. We provide messages that are exclusive for women and exclusive for men, according to their different needs. And we also share this important message of being attentive of what children have to say about violence. So, in conclusion, working together with the ECCD centers has allowed us to support the work that the coordinators do as key members of their communities, and to ensure together with them that the homes are being a safe place for girls, boys, and adolescents. So This is, well, you read a couple of examples of the results that we've been having for this work. And these are words of one of the coordinator of one of the community centers here in Mexico City. So that would be all from me. Thank you very much for your attention.
We do have some questions about if there's any examples of good practice or of integration and working across sectors. So what I would like to encourage and to remind everyone that this guidance note is a living document. It will be updated and it will evolve as we learn more about how to effectively engage with communities during this time. So if you have any examples of adaptations you have made to how you engage with communities, or if you have any sources of guidance that you would like to share, please don't hesitate to send those to the Community Level Child Protection Task Force email. So thank you so much, everyone, and have a good rest of your day.